All right, top of the morning to you. Welcome to the Aired Out Podcast, live from Fly on the Wall Productions on this beautiful Tuesday morning, the 15th. Happy tax day today. Hopefully you don't have to file for an extension, but I know a lot of the accountants going to be pulling their hair out and drinking plenty of coffee today, and many of the PCAs and tax offices going to be open late today. So if you can, exercise a little bit of patience if you need to get in there today, and be good to them. Maybe even bring them something, a donut or something. I don't know. Hey, happy birthday today to my good friend Mark Tatro. He's on the list, along with Carol Williams, Curtis Franks, Stephen Weston, Brian Farnham, Jason Woodard, Mark Ellington, Tiffany Crow, Desiree Simons, Tanya Ashford, and Devin Sater. Happy birthday, everyone. We're looking at a pretty nice day today. Some sunshine, giving way to clouds, and some rain coming in the late part of the day. Highs around 61. Boy, that 65 was really, really nice yesterday. Maybe some more wet weather coming in tonight and tomorrow. Well, they're saying maybe even some snow showers. But hang on, relax. I know it's not going to last long. Great time of year, though, to think about getting some summer tires on if you haven't done so yet. I know so many places they're just getting ready for the insanity of summer tire changeover. I know over at Montpelier Mazda and Montpelier Volkswagen, they are very busy, but they're always ready for you. So stop over today and think about getting some new treads underneath your vehicle. Tomorrow, Wednesday, April 16th, is National Healthcare Decisions Day. It is an annual observance of awareness about advanced care planning and having conversations, albeit uncomfortable at times, about healthcare wishes. In the business spotlight this morning, presenting sponsor of the Aired Out Podcast, Central Vermont Home Health and Hospice, who is partnering with the Barrie Rotary tomorrow to offer a free educational workshop over at the Aldrich Public Library about advanced care planning and filling out advance directives, and more importantly, getting questions that you might have answered as best as possible. President and CEO Sandy Roos with Central Vermont Home Health and Hospice's palliative care nurse practitioner, Dr. Kelly Elwell. Welcome to both of you. Thank you so much for being in here today and being part of this conversation. This is great stuff. Thank you so much.
Good morning.
Good morning, JD.
Happy to have you back.
Thank you for having us back.
Man, this is, and I was talking with my wife about this, about how this is not the most exciting conversation to have when you're talking about advanced healthcare planning. This can be something that is uncomfortable, but I think the three of us, and we were just chatting off the air, can give testament to how important it is. How many people do we know who say, oh man, I've been through an experience, or frankly, I've been through a war that it may still have been difficult, but maybe not as difficult if I was better prepared. Admittedly, and I think, Sandy, I think I've said this to you in the past, admittedly, I was one of these guys who kind of had my head in the sand a little bit about this and was just trudging through life, going 100 miles an hour, and understanding that, my mom and dad are aging, but never really fully grasping the magnitude of the storm that I was head first right into and didn't know. This is really important stuff.
It really is, JD. I know what we find, and certainly Kelly is a lot closer to it with regards to direct patient care, but ultimately situations happen. Somebody ends up at the hospital, and now all of a sudden, not only are they making decisions about possibly what they've learned, that they have a serious illness or a life-limiting illness that has taken a really negative turn quickly, ultimately they're having to make a lot more decisions related to that, and the family's there, and or loved ones there, and it's really difficult. And especially in that setting, there's focus on, okay, I just really want to be able to get home. And ultimately, when you're doing it at home, you have the ability, or outside of a hospital setting where you're kind of in crisis anyhow. If you're there and you're inpatient, there's been a situation that has put you there. And ultimately, it gives you the opportunity to really think about, the trajectory of the disease you may have, or the trajectory of what's just happened, and really process that a bit differently, and really think about, do I want my loved one doing my personal care? What does this mean? It allows you to learn in a space that doesn't feel so on demand with having to have answers or make decisions. It gives you more of an ability to really think through it a bit and be in a place that's comfortable to you, which is your home, and really think about all the things around you that can impact it. And I'll certainly let Kelly speak to it, because she does a lot of that directly with patients and with families and individuals around it. So,
what is it like, Kelly?
I worked as a hospitalist, and I've worked on the ambulance service, and one of the things that I learned in those two experiences is that no good decisions come in the back of an ambulance. No good decisions are made in an ER in a crisis setting. And the number of folks that are going back to the ER with terminal illness that don't want to be there, but they're kind of on this hamster wheel of they're not sure how to make a change to their care plan. I think that is the hardest thing as a provider to see, because there's other ways. There's other ways to manage your needs and your symptoms. And by having an advanced care plan, you can ensure that your wishes are going to be followed as best as the medical community's ability. There will be times when you need to seek care that you weren't planning on or that we didn't plan for. But having your words down on paper ensures that you get what you want, and we're following your wishes, and that your family is following your wishes and hopes and dreams for the end of your life, rather than them making decisions based on your behalf, which is really nice, because especially for patients with dementia, if we do this early, they're able to make decisions for themselves that if we wait too long, they're not able to.
I got to tell you, I'm sitting here, I'm listening to you, and my mind is racing. I have so many questions, but one of the questions that I'm asking is, hey man, what do you have going on tomorrow? Do you have time to get over to the Aldrich Library? Where is your advance directive? Is the one that the hospital, assuming that they have it, is that the same one that you have at your house? I'm asking these questions to myself right now as I'm sitting here listening to you, and I'm like,
that's a good question.
I got to get over to the Aldrich Library tomorrow.
That's a good question, because you can change your advance directive.
Absolutely.
What you do today and what you want today may be different than what you want tomorrow. Or if you go to the hospital, it doesn't mean that they're just, going to look at that and say, okay, this is what you signed up for. You're still part of your decision making if you're able to make those decisions.
And this is that question that. And I've heard it several times. Is there an advance directive? Whether I'm bringing someone to the hospital, or I remember when Sherilyn had her gallbladder out. Is there an advance directive? I think so. Well, do we have it on file, or Do you have it on file? You know, where is it? I mean, these are the things you want to keep with. You want those documents, and you want to be able to have access to them at home quickly, whether it's in a safe or whatever. Keep it right there with the will and all the other stuff.
Lots of times we tell our patients to put it like on the side of their fridge. So,
Sure.
you know, with family members, I do that. I have it on the side of the fridge and all of that with any DNR, DNI,
Yes.
and all that information, because actually, you know, the emergency services are trained to kind of look in those spaces.
Absolutely.
And look for that. So
On the fridge.
yeah.
We say the word advanced care planning, and of course, you know, we're going to talk about illnesses that are slow going. But also, you know, frankly, this is something tomorrow, and we got to get to exactly what you're going to be doing over at Aldrich. But this is something that is important for really any age because of emergencies.
Absolutely.
This isn't just people getting old and dementia and whatnot. This is emergencies.
Right.
Absolutely.
It is an opportunity to learn too. So it doesn't mean you have to go and complete something. It's an opportunity to gather information.
Right.
I know I'm one that always likes to hear what others have to ask. Like, what am I not thinking about? Or, oh, that's a really interesting question. I hadn't thought about that.
Yes.
So it is really an educational opportunity. And I'll let Kelly speak more to how she educates.
Yeah, please do. And I'm curious as to what questions you've heard, Kelly, that are kind of interesting.
Absolutely. So I recommend them for anyone that's over the age of 18. Once you turn 18, your parents or your guardian is no longer your person. They could be, but it doesn't legally mean that. So even if you don't, you know, even if you're really young and you want everything done medically to resuscitate you if something was to happen, you should still complete the first page of the advance directive. And basically that's saying, this is my person, this is my healthcare agent. If something happens, if there's an accident, if I have a sudden illness, this is who you need to call. And just getting that done is extremely important. Especially for, you know, I have a college-age daughter, so for folks that are out of state that are going to college, things can happen, making sure that they know who to contact, or family that lives alone and doesn't have a spouse, that's really important as well. A lot of questions that I get, does it mean that these folks are making decisions all on their own? And no, that's not the case. If you write down your wishes, your healthcare agent is meant to follow what you've written down. Now, occasionally there will be things that come up that weren't on the form or that we didn't expect, or that you said you wanted CPR and intubation, but now you've been on a machine for a while and things aren't looking good. They may need to make the decision to take you off the machine. But typically, everything is going to be followed that's on that form.
You know, I'm thinking of these 18 and 19 and 20-year-olds that might be going through life just thinking, if anything happens to me, my mom and dad will answer questions and all that, and that's just not always the case.
Correct. Yeah. So it's important that everyone, even if you think that it's very clear who your person would be, you know, your spouse, that's not always the case. I take care of so many folks that would not want their spouse making their decisions whatsoever.
Wow.
And that happens all the time.
Isn't that interesting?
Yeah, it's just that isn't the person that they would want to uphold their wishes.
Yeah.
Maybe that person would want to keep them alive longer than they really want to be kept alive.
That's so interesting.
And the other thing that, you know, to Sandy's point of keeping it available and putting it on the fridge, I always have folks take pictures because now we have the smartphone. So having a copy, right, that way if you're traveling, you have it with you.
Right.
Or should always send it to your healthcare agent. You should never pick a healthcare agent and not let them know that you have chosen them as the healthcare agent, because you don't want them to get a phone call in the middle of the night and them have no idea what your wishes are.
Wow.
So I encourage folks, when you pick someone, let them know, have a conversation about it, and also send them a copy of what your wishes are.
So What are you doing tomorrow? What are you guys going to do tomorrow?
Yeah, so we're giving a presentation at the Aldrich Library, and we're going to be talking about what advanced care planning is, what a COLST form is, how to complete those. You can come and listen, you can come and learn, you can come and fill out the form, and then we'll witness it and sign it afterwards. You can complete a COLST form if there's limitations to your care that you wish to have. So I like to refer to the COLST form as the, which is the clinician order for life-sustaining treatment, if there's limitations in your care. If you are a full code and you do not want any limitations on saving your life, you do not need a COLST form. But I like to consider that the prescription that goes on the refrigerator, and that's what the ambulance and the hospital will follow. And so I think that it'll be a good opportunity to get folks to be thinking about it, ask questions, but then also completing the form while we're there.
This is something that you guys are not doing every month or every other month. This is an opportunity. You've got to take this while you can. This once a year?
Typically, sometimes we do it more often. I mean, I do this every day in my everyday work,
Yeah.
but to have a group setting where you can come and interact with the presentation, yes, it's once a year usually.
And you've done this in Montpelier in the past. What was the turnout like?
We had a great turnout, and unfortunately, it was a couple years ago that we did the Kellogg Library, and COVID was still. People were nervous, so I think that this turnout will be even better. We've done a lot of work at Westview Meadows and done presentations. The turnout for that was amazing, so I expect a good turnout tomorrow.
So tell me about the partnership with the Rotary Club and how this all got steered this way.
Yeah, I think the Barry Rotary is well known in the community, connected, very connected to the community, and Aldrich Public Library obviously is a place that people come together, and it's very community based. Barry Rotary has their luncheons, their meetings there once a week, and we thought it was a great opportunity. Emily McKenna, our Chief Advancement Officer and Marketing Officer, is quite connected with different organizations throughout the community. So we thought, why not? It's a place that people congregate, and ultimately the Barry Rotary meets there, and why not?
Yeah.
So
what about, I'm thinking about the will and all this stuff, but is this something where you can download the Vermont Advance Directive for free, print it out, fill it out? But you guys are going to have this
Absolutely.
physically tomorrow.
Right.
Okay.
And the advance directive, you do not need a medical provider to witness that for you, and it does not need to be notarized. So if you can't make the event, you can certainly do the form on your own. It's pretty self-explanatory. And then when you get to the end, you have to have 2 witnesses, and those witnesses cannot be named on the form.
Yeah.
They can't be someone that you're related to, but it could be a neighbor, it could be a friend, it could be a coworker, and you just need 2 witnesses that basically are saying that this person signed on their own free will and that these are their wishes. The COLST form, you have to have a medical provider.
Okay.
So that is a little bit different at this event, that we'll be able to actually complete that form, because I can sign those for folks.
This is amazing. What a great opportunity to do something like this.
it is a great opportunity to, especially, caregivers or families that are caring for someone with dementia. Kelly is certainly an expert on dementia, and, to really get people thinking about how can they support their loved one through this journey, which could come to a place where that individual can't make their own decisions. And, what things to think about as they're thinking about making sure this document is completed.
Yeah. Kelly, I was listening this morning, and there's a new study that came out. I didn't catch the source, but I'm sure if you Google it, it'll be right there in front of you, that age 64 and over, that the next 10 years that America is supposed to experience the greatest number of dementia patients in history.
Absolutely.
Over the course of the trajectory of the next 10 years.
Yeah, so medical science has been amazing in keeping us alive longer, but that doesn't come without consequences or other illnesses that maybe 100 years ago we weren't dealing with.
Sure.
And dementia, even though all of the research that's been done and how prevalent it is, it's not well understood. And if you haven't dealt with someone that has dementia or dealt with a family member that's been caring for someone with dementia, you really can't understand what they go through. And not all dementia cases are created equal. Some are a breeze and things go well, and other times that's not the case. And managing those behaviors and teaching family members how to care for their loved one, because it's not something that we're innately born with, that we just know how to manage these things. And lots of times the things that you would think would be the right way to approach someone with dementia, it's the actual complete opposite.
Wow, is that true? Man. And so many of us that have been down this road know that. You also think you may have a little bit of a grasp of what to expect. You don't.
Until you don't.
Right.
Yeah.
And once again, advanced care planning and really thinking through that really makes you think about, what if we get to a place where it's hard for me to take care of my loved one with dementia? What does that mean? What supports would I need to have in place? So it really does open up more than just defining someone's wishes. It really makes you think about that disease progression and what that may look like. And as a result, as it comes near or happens, and especially at end of life, it's proven that by having advanced care, having done advanced care planning, it actually helps everyone that's involved with a very difficult situation of a loved one be a bit more at ease, that at least they know and they've planned for what may happen. It's not a perfect science. As Kelly mentioned, there are always going to be things that come up that you didn't plan on, but at least if you can plan for the things that you may have control over, then that alleviates some of the pressure.
And let's just air it out and say it like it is, transparently. Your family dynamic is 100% guarantee it's going to change. And some of you might get closer, and some of you may have a wedge driven in between you. Things are going to fluctuate. Things are going to change. It's a guarantee.
Serious illness will put stress on any family, but especially with dementia folks, just because they aren't necessarily going to act the way that they used to act. They're not necessarily going to be the person that they used to be. And I always say to families, I lost my grandmother to dementia, and you lose them twice. You lose them when they lose their memory and they can't remember things, they don't know who you are, and they're acting differently, and then you lose them again when they actually pass away.
Yeah. Which, so many of us who have been down that road have felt some relief, frankly, and some guilt attached to that relief, and also some, and I know I'm going down a different rabbit hole here, but also some guilt of what could I have done differently when they were alive. And this is a ugly, ugly, ugly disease. Absolutely. It really is, and it's different for everybody. There's happy and relaxed, and there's mean and ugly and paranoid, and it's a ride. It's
and
a roller coaster.
Can all happen in the same day.
Sure. Yes, it can. Same hour.
Yes.
And the onset of this can be quickly. It can be fast, and it can be a slow onset too.
Absolutely. And I think it's important to remember that when you do the advanced care planning, especially with folks that have dementia, they will be able to speak their wishes, be able to speak for themselves when they can't any longer. And one of the things that I hear over and over is, I don't want to be a burden to my family. Yeah. But I also don't want to fill out this form because it's scary and I don't want to talk about it. But the best thing that you can do to not be a burden on your family is to have your wishes in writing.
And suck it up and do it. Get it done.
Right.
Absolutely.
As uncomfortable as it is.
Absolutely.
Yeah, I think this is fantastic that you guys are doing this. And just remember, just have this in the back of your mind. This is not, the importance of this is not just for older folks. It is for anyone who can experience any kind of sudden emergency, and you've got your ducks in a row.
Right. Ultimately, it's really focused on, the care you want to receive where and when you want it.
When you can't speak.
When you can't speak if you have a life-limiting illness and you want the loved ones around you
Right.
to help you make those decisions, I think at some point, people do get at a place where if they have something significant happening, it's
Right.
helpful to have somebody they can lean on a bit.
Sure.
That really understands them
And
and understands their wishes. And I know I've experienced that a couple times, and it just, does alleviate the pressure because there is a known, and it allows you to have, honest conversations about, this is what's happening. What do you think? Just to test to see if somebody does think differently about it when it gets there. And, personally, I'm in a situation where I am, durable power of attorney, I'm healthcare agent and all of that. And by going into it, it's just a lot easier to talk about it with that person, and that person knows they can lean on me a bit, and I understand it, and still learning. You learn every day, right?
Yeah.
But it's a lot easier to do it that way. And I've done it without planning in place. Yeah. So it's like a very stark difference.
I remember the conversation of telling Dad, that he wasn't safe for him to be driving anymore. That didn't go over well.
Yeah, usually doesn't.
Right.
Who do you think you are, telling me, I raised you, and we're starting to reverse roles here.
Right.
And that's a really uncomfortable thing. But also, in addition to that conversation was the one of, and I remember it well, Dad and Mom, what's the deal with an advance directive? Am I involved here? What's going on here?
Absolutely. Yeah, and that's why I like events like this, or I like doing advanced care planning in folks' homes, because it's really important to take that pressure off the family dynamic. Lots of times when we ask, especially older folks in our family, hey, I would love to know what your plans are. They're not going to do it. They don't want any part of it. They don't want to have that hard conversation. And I can come in, or another medical professional can come in and say, listen, this is on me. You can blame me. I want to make sure that we as a medical community are doing right for you.
Sure.
And let's get this done. And 98% of the time, folks are so grateful that we got it done, and they're actually less stressed because they don't have to worry about it. They know that their family now knows, and they didn't have to bring it up.
Right.
They didn't have to be the one that had the hard conversation. It was on me, which is, I kind of like that. It doesn't have to be doom and gloom.
Sure.
Typically, we're laughing and joking through the whole thing.
That's wonderful. That's the way it should be. I think about lawyers and wills and trusts and all of this stuff where you need to bring a very sharp pencil. But this is... and your checkbook. This is an opportunity for you to, keep your wallet and your checkbook at home and come and get these forms and have the conversations about how to fill. You don't have to, like you said, you don't have to fill them out then. You can take them home and chew on it for a little while.
Right, absolutely.
But so important to do this and to have this opportunity with Central Vermont Home Health and Hospice saying, hey, we're here. What questions do you have? What about folks that they've got this kind of stuff buttoned up a little bit, but we're now starting to maybe wonder at what point do we drop the clutch and start saying, do we need to talk about the hospice road?
Yeah. So palliative care is a big part of advanced care planning, and that's what I typically do on a daily basis, is go in and talk with folks about their wishes, pair that with where they're at in their health journey.
Safety.
Yeah, exactly. And then we talk about what their wishes are, their overall goals. And if their overall goals are to be home, to be comfortable, and not have restorative care or not have life-sustaining treatment, that's the time, if they meet criteria for hospice, that we start talking about hospice. I think that, advanced care planning is perfect for, and palliative care is perfect for anyone that has chronic illness. And hospice is for anyone that has a terminal illness.
Boy, can you just say that one more time? I think more of us need to hear that.
So palliative care is for anyone that's suffering from a chronic illness. Cancer, diabetes, lung disease, heart disease, and they're still wanting restorative care. They still want to go back to the hospital, have treatment, try to do things to turn things around as best they can. But hospice is when you've decided that I do not want to undergo restorative treatment. I have a terminal illness and I'm choosing to remain comfortable.
Yeah. That's amazing.
Right.
I know there's so many people that are nodding their heads this morning. Go ahead, Sam.
Both really focus too on quality of life, right?
Absolutely.
So palliative care is kind of the bigger umbrella, and hospice is a piece of that under that umbrella.
Sure.
And ultimately, the work Kelly does with individuals and the conversations she's having is really educating patients about their disease and the disease progression, managing pain and symptoms. Really focused on that quality of life if they want to continue to seek treatment. And ultimately, if they're in a good place and their disease is naturally progressing,
Sure.
that's not a bad thing. It's just, being informed, having knowledge, and being able to manage those pain and symptoms. And Kelly works with them and collaborates with their current healthcare team in place to really make sure that they can be as independent as possible and have the support they need in the community to remain at home, remain as independent for as long as they can. And, really supporting that quality of life overall is really key. And both palliative care and hospice really focus on that, maybe in a little bit different ways, but ultimately that's the goal. So Kelly's really able to work with those, clients and potentially see them through to then going on hospice when the time is appropriate.
So many of us are so stubborn. We love our independence. We love our pride. We love our egos. We don't want to succumb to anything. We don't want to ask for help. We want to be able to cook our own meals, drive our own cars, pay our own bills. All of the list goes on and on. What a job you must have, Kelly, to be able to say, no, you can't in a professional way.
Yeah. Some conversations are harder than others, but I think that it's the best job in the world to be able to give the tools and resources to families and patients to take some of that autonomy back.
Yeah. You got some broad shoulders.
Yeah.
You have to.
Yeah, it's the most rewarding job for sure. There's so much that goes into it. I love medicine, but I love the human piece of medicine more. And I think that the wonderful thing about palliative care is that I can follow them on their journey. I can see them when they're first diagnosed, and then things go great, and maybe they're discharged for a while, and then we bring them back on when things don't go in the greatest.
Sure. I'm sure you have wanted to say many times in a week, "I told you so."
A few times an hour, maybe.
Yeah.
Yeah, I bite my tongue a lot because it's not my place to, sometimes when we know things are going to happen and they're making their own path.
Sure.
Right.
And whatever journey they're on, that's the train. I always tell patients, whatever train you're on, we're on that train too. And I make sure, especially in families that don't agree with the current treatment plan or lack of treatment, I make sure to mention that in my consults, that you're the focus and we are all on this train with you. and we're going to educate you and give you all the tools and resources to be successful, but also on the other side of that, making sure that we have a safety net to catch you if things don't work out the way we hope for. I always say hoping for the best, but planning for the worst.
Sure.
We're hoping that things are going to go the way you want it, but what's the backup plan?
Yeah.
What is the plan that if this doesn't work out?
Right.
Your patients are not just the individuals, it's that individual and their entire family that you have to deal with.
Exactly. And individuals in that family unit, because there is never a family that is completely 100% on board.
Right.
Even if they are on board, there's still internal struggles emotionally with, oh, I would have done it this way, or I wish mom would do this, and so I think, the other piece of palliative care is making sure that anytime a patient is accepting treatment or not taking treatment, that they're informed on both options.
Sure.
Because you can't have informed consent about going through with cancer treatment, for example, if you don't understand what would happen if we don't treat.
Yeah.
And what that could look like.
Sure.
And so I'm really passionate about making sure that if you're going to make an informed choice on treating, that you also know what it looks like to not treat. Because sometimes the treatment is worse than the disease.
Isn't that something? Well said.
Right.
I'm sitting here thinking of all of your nurses who are boots on the ground, who are diving into the family dynamics head first. They're there every day or every other day or whatever, and have to frankly maybe even be a referee at times.
Right.
They're in the thick of it.
It's a group effort for sure.
It definitely is. It's really hard to see your loved one decline. And we've seen this a lot, especially more recent. It seems like there are hills and valleys and lots of individuals, ending up at the hospital.
Sure.
And from the hospice perspective, being admitted to general inpatient care, where ultimately they're at the hospital, they're probably not going to leave, and they're going to pass away there. And just to give that family some extra support, especially when that loved one dies, to be able to have that bereavement and grief support, 13 months beyond their death is really important. And ultimately, how do we go upstream and really be able to get out there and talk to individuals and their families about, what does this look like and what decisions can we make that may look a little bit better than being in a crisis situation where all of a sudden they're at the hospital and now they find out this is it.
Well, you're being proactive. Central Vermont Home Health and Hospice is being proactive by having this event tomorrow at the Aldrich Library. I mean, that's just, it's frankly, I would be thrilled if this happened several times a year. But
Right.
how many Kelly Elwells do you have on your staff?
We have Kelly Elwell
Yeah.
running the palliative care program.
Yeah.
And ultimately, we have our hospice staff that can certainly have some of these conversations. Kelly's done some trainings with our staff in the organization to be able to do this as well. Sometimes we refer back to their primary care physician because that's the person that means the most to them in their care, right? So we try to be really sensitive about their relationships in the community as well. But primarily, Kelly does a lot of this work, and the staff do lean on her and refer to her, their patients that they're seeing, to have these conversations and even, have family meetings. She works very closely with some of the facilities in the area.
Absolutely.
And that's been a real key in supporting, above and beyond what the facility is doing on any given day. So, a good share of her work, her first year with us was 2023. In 2024, she came close to doubling those encounters.
Wow.
And certainly she's touched a lot of lives.
So your phone's ringing. You're moving. You're moving around. But it's all the skilled nursing facilities. It's retirement facilities. It's Central
Assisted
Vermont
living,
Hospital, assisted living,
Memory care.
memory care.
We do a lot of education in the facilities, teaching the staff how to manage folks with dementia or folks with aging illness, and making sure that everyone feels comfortable and has the support they need in caring for older population with pretty serious disease.
Yeah.
One of the things that, 20 years ago, we would see folks in the hospital that were ICU level, and they are, now up at Burlington with, in more intense care. And the folks that were on ICU are now on the main medical floor. And that trickles down. So folks that would be typically in the hospital or at home with home health. And so we're having to provide more intense care in all settings. And that includes facilities and at home for the families.
Right. And I do want to mention we partner with our, good partners. Central Vermont Medical Center has an inpatient palliative care team. They do tremendous work, and sometimes they will refer to us to follow them outpatient. And, certainly if there's patients there and they're referring them to whatever level of care within the organization, there's a warm handoff. And CVMC, I believe, is doing an advanced directive gathering tomorrow as well in their main lobby, in their lobby downstairs.
And this is all not stuff that's Monday through Friday, 9 to 5.
Right.
Correct.
This
is happening 7 all the time.
Right. Yes. And Kelly is available pretty much, it seems 24/7. Wow. So definitely, once you touch somebody in their home, then, that's a pretty strong connection.
Sure it is, of course.
That we have to maintain and keep. But certainly Kelly also works with Diane Jones. And Diane actually worked at the Cancer Center for many years as a navigator. And so Diane's our complex and palliative care coordinator. And she has a lot of touch points in the community, really working with lots of complex individuals. So her and Kelly partner on this journey with palliative care. And in addition to that, we have a volunteer that supports, if we have somebody that Kelly's seeing on palliative care, managing pain and symptoms, she's following them for a bit. She's got advanced care planning in place. She's connected them to other resources, collaborated with their current healthcare team in place. They may be discharged for a bit. So we have someone that's staying connected with those individuals, making sure they know we're here for them if something changes or if something's come up. So really keeping, and maintaining those connections is really important to us as well.
Does this line of work make you, your care providers? At the end of the day, that's what you are. Whether you're the CEO or you're a doctor of palliative care, a nurse practitioner, your care providers. It must make you quietly think about your own life at points.
Absolutely.
It's got to.
Yes.
Makes you think differently about how you live each day and what you would want for yourself. We see a lot of suffering, whether that's emotional suffering, whether that's physical pain or symptoms, families. And I think being able to affect that in a positive way is so meaningful that it makes you hope that your impact has a ripple effect and that can help other families.
And you probably also have to go about your career as more than a career, but a mission, and that if you were walking in these shoes, that you would want someone exactly like you doing what you're doing for these folks, for yourself. And Sandy, same for you.
I'm surrounded by a lot of great people at the organization, so I feel really lucky. And
I have to just say before I forget, kudos to those who just won all of these awards. Talk about that for just a second. I mean, look at these remarkable ladies that have been in the spotlight lately.
Yes, we've had several individuals. We try to recognize those milestone years with the organization. And it's pretty incredible when we look at that, and even new staff coming on. Diane Jones is a perfect example of her commitment to this community, to the organization, to the staff, and how she can support them. And, we're really fortunate. Most people that come to work for us are really committed overall. And it's not easy. There's a lot of, as Kelly mentioned, those individuals that were in the ICU are now on the floor, and those that are on the floor are coming home a lot sicker, and yes, are going into a facility. So ultimately, it is definitely the ripple effect, and we do really rely on our relationships with our referral partners and our partners in the community, not only in healthcare, but all the other aspects of what an individual needs to be successful and live independently.
How did town meeting day, speaking of what you're talking about right now, community support and whatnot, what were the results of town meeting day with looking for community funding?
Right. So our service area, we serve 23 towns or cities, and 21 of those towns and cities voted in March, and they all approved our budgeted line item, whether it was on the ballot individually or already included in the town or city budget. And there are two more towns, a town and a city, that are going to vote, Barrytown and Barry City, in May. And we're waiting for those results once the polls close on May 13th.
This is just kind of taking a little bit of the edge off.
Right.
And picking up for...
What we were able to do in 2023 is we actually used some of our town funds to actually start the palliative care consultative service.
Bingo.
So ultimately, it's a way for us to use the monies and look at what our community needs and what are the things we can do differently to better support the individuals that we're touching in the programs.
Our needs are increasing.
Right. What ancillary services do we need? So certainly with palliative care, we look on the horizon to expand that. So there will be more than one Kelly with us in the future, and ultimately trying to figure out how we do that expansion and what that looks like in the bigger scheme of things with regards to other funding that is not so great and all of that. So
well, what is great is the need. The need is great, and it's going nowhere but up.
Right. So anybody that votes yes is really giving back to the community, and certainly we've done that over the years, whether it's been through our Choices for Care program with those non-medically necessary services, whether it's been through Kelly's work with palliative care consultative service, certainly our hospice program. There are always things people need that aren't covered under the Medicare benefit that people just don't have the means and resources to obtain.
Yeah.
Lots of times we really want to work with families on those final wishes.
Sure.
And what does that look like? And we have a couple coming up in our hospice program that are pretty amazing. So that's really something to look forward to. And all those conversations start, whether the individual is on home health, on our palliative care consultative service, and or go to hospice.
The consultative services, so you're going to people's homes, sitting down and meeting with them.
Correct.
For, I'm guessing, an ungodly amount of time.
Usually.
Could be. Could be. Yeah.
Yes. Whatever time it takes.
Whatever time it takes. Wow. And Choices for Care, I got to say, testimony to that twice for both of my parents was just amazing. I don't know what we would have done without it. And I've got a file cabinet full of notes that show how important and how critical it was. You don't really realize how badly you need something until you need it.
Right.
And once you've had it and you can look back at it, you can say to others, man, oh man, you might need this someday, and it's going to be there for you.
Right.
Yeah. Tomorrow is going to be a great day over at the Aldrich Library. This is the National Healthcare Decisions Day. Tomorrow, Wednesday the 16th, and Central Vermont Home Health and Hospice has decided to partner up with the Barry Rotary and head to the Aldrich Library, where, what time is it going to be held again from?
1:30 to 3.
1:30 until 3.
Yes.
All right. So you got an hour and a half to sit down with palliative care nurse practitioner Dr. Kelly Elwell, CEO Sandy Roos, and others that I'm guessing are going to be there as well.
Absolutely.
Yes.
Yeah. And ask some tough questions, or if you're on the fly, just grab some paperwork,
Right.
and maybe give a quick listen to what's being presented, and don't take it home and let it get buried on the kitchen table.
Right.
Just do it. Just do it. Get this paperwork filled out. There's so much to this, and we're barely scratching the surface of what to unpack here. But I said yesterday on the air, there's a lot of goofing around and fun that we do here on Aired Out. But man, it is so important to tone it down and to get serious now and then, and give out some really critical information. And it's not just the importance of having an advance directive, which is a whole separate thing, but also the importance of taking this opportunity tomorrow and being at this event at the Aldrich Library.
Right.
I got to be there. I got to be
Right.
there.
It's really education, right? So
Yeah,
if
of
you,
course.
even if you have a few minutes to grab a coffee and some sweet treats, our
Sure.
Community National Bank is helping sponsor that.
Really?
And certainly, yes.
Oh, I'm
So
totally
there you go.
there now.
There's food, JD, right? And just pop in and take a listen. And if it's
Yeah.
if you get what you get out of it in a little bit of time,
Sure.
feel free to step out. But ultimately, if anything, like I always think of it as, if you hear somebody else ask a question, you're hearing somebody else with information.
Sure.
There's bound to be something that you're going to learn.
Yeah. What time, Kelly, will you be speaking?
1:30, from my understanding.
You're going to speak right at 1:30. And how long will you go for?
It's usually these are pretty interactive presentations. So if there's a question, I'll stop. I'll probably about an hour roughly.
Okay.
Questions at the end, and then filling in the forms as people need.
Okay. I also want to say, before I forget, that if you've had an advance directive and you're assuming that your local hospital has it on file, and you think you may have updated it at some point, the one that the hospital has is the one that holds. Is that true?
Not necessarily.
No, yeah.
So whatever is the most recent date. So I recommend updating your advance directive and COLS form yearly. If nothing changes, you don't have to do a new one. But if there is changes, you should update yearly.
Okay.
And then take a copy of that to your doctor's office, to the hospital, and make sure that they scan it in. And take it to, make sure that home health has it. If you seek care at Dartmouth or another facility, make sure that they have it, because they don't always talk to each other.
Yeah. I know that's, pardon me, that's been something that I've run into a snag in the past. Well, we've got one here, but it's it's signed by your ex-wife or whatever.
Right.
Whatever.
Right. Yeah.
Something that's
I think
that's
Kelly
outdated.
mentioned, you've taken a picture of it on your
Absolutely.
phone. Like I have multiple places that I store different things.
Yeah.
And so I have something on my phone, I have a paper copy at my house. I have,
Sure. Sure.
I have it on my computer saved. I have it, all
Especially
different
for
places.
traveling,
Yeah.
it's really important to have it
Didn't even think
on
of
your
that.
phone, because it's harder to carry things around if you're on
Right.
vacation. But your phone it's one thing that smartphones are good for, is to have your advance directive.
Right.
And maybe especially if you're not married but you're in a domestic partnership.
It doesn't automatically go to that person. It doesn't automatically go to your eldest son in your family
Right.
if you're, if your spouse if you're widowed.
Sure.
We don't have common law in Vermont, and it doesn't automatically go to your spouse either. So it's really important to make sure that you have chosen a person that can speak for you when you can't speak and would speak the same language that you would want.
Really trust.
Yes.
Your life with.
And that's why, like I said, some spouses are not the person because they would not follow the wishes. They would want to keep someone alive longer than they'd want to be. So just pick someone that you trust, pick someone that you know could follow through with what you want, and make sure that person knows.
Yeah. This is going to be really tremendous tomorrow. 1:30 it starts at the Aldrich Library. Thanks to the Rotary Club. And don't forget, get out on May 13th and cast your vote to support community funding for Barre City and Barrytown when you vote for Central Vermont Home Health and Hospice. Anything else that I'm forgetting, Sandy or Kelly?
I don't think so. I always think too, if some people aren't comfortable in a open setting, so certainly you can go to our website www.cvhhh.org and complete an inquiry there. You can certainly call our main number at 802-223-1878 and ask to speak with the palliative care team. And that way, too, you can hook up directly with Kelly to be able to have those conversations with her individually as well.
Speaking of your website, career opportunities.
There's always those.
There's a
Yes.
pretty good list of them, and they're impressive. I mean, and you guys take well care of your employees. So yeah, hop on and have a look at that site today. Thank you both so much for being in here and having this conversation. And thanks to Emily McKenna for all she does as well. Please come back and please be there tomorrow at the Aldrich Library at 1:30. National Healthcare Decisions Day, April 16th. And we encourage you to play an active role in advanced care planning, no matter how old you are. And I think we've driven that point pretty well this morning.
Right.
Just be there, be part of it. It's free. You're going to get some snacks, and you'll meet these great ladies. Thank you both again so much. I think your whole team, I was going to say both of you, but it's your whole team are angels on earth. What you're doing for our community is massive. It's massive. Thank you again.
Well,
Thank you.
And have a fantastic rest of your day. We will see you tomorrow. Don't forget, we've got a great rest of the week. Tomorrow morning, I've got an interesting gentleman who's finally going to be making his way into the studio and talking about a huge motorcycle event that is coming up, big benefit. Thursday, we close out the week on Friday with Rex. Have a fantastic rest of your week, and we'll catch you again real soon here on the Aired Out Podcast.